And if there are any investors out there, femtech is also a really opportunistic investment to do, because we have far too little when it comes to studies on females as opposed to males. So now we're going to dive into a panel with some distinguished guests that's really going to dive into female longevity, femtech, and also vitality. And this is going to be hosted by our longevity queen, let's put it that way, Tine Hertz, who of course I'm sure all of you know. She's the co-founder of Copenhagen Health Week. She's also the founder of the 130 Labs and has her own podcast, 130 Biohacks. So please, let's give a warm welcome to Tina, and also her panelists, Caroline Feibeck, Rasmus Just, Dorothe Snejeberg, and Dr. Christian Brayman. Welcome up on stage.
Thank you. Thank you so much. And thank you guys for being here. I really personally have a very big stake in this panel talk today. I think it's so important that we put more focus on female health, on female longevity, understanding our cycle, understanding the different phases of life that we as women go through, which, I'm sorry guys, are a bit more complex than your journey. So with me, I'm very excited to have put together these amazing experts and people on this panel. Caroline, Christian, Dorte, Rasmus, I will let you introduce yourself before we dive into the topic. Maybe you start, Caroline?
I can. I am Caroline Feibeck. I'm a naturopath, and I'm also a complementary hormone therapist. And I'm the founder of the Institute for Complementary Hormone Therapy, and I am an author. And I'm a woman.
Yes. Very important.
Hello, you hear me? So my name is Christian Brayman. I'm based in Zurich, Switzerland. I'm a professor of gynecology and obstetrics, and since long time in Switzerland. I'm not a woman, but I'm a gynecologist, and I deal with female health and for a long time, since this is also my profession. I'm also actively involved in gynecology, surgery, and obstetrics. But my hobby is hormones, iron, and vitamin metabolism. And I think that's and we are also friends and have podcasts together. So I'm happy to be here. Thank you.
Yeah, and first of all, thank you for having me. My name is Dorthe Snejeberg. I am a woman and a gynecologist and obstetric, and I have my own outpatient clinic where I see patients. I have an intimate care series that I founded and launched this May. We have a booth over there, and I'm trying to do the best I can to share my knowledge at an Instagram account, and I've done a PhD in HPV virus and the immune system, the effect there. But I have a special passion and more into menopause as well. Mm-hmm.
Thank you. Yeah, my name is Rasmus Just. I am not a woman, and I am also not a gynecologist, but hopefully I can contribute with something else. I have a PhD background, and I started my career in pharma, innovating and developing osteoporosis medicines. I have since then moved on and have primarily focused on inflammatory diseases and metabolic diseases. And today I work as a corporate executive in a large pharma doing business development. But osteoporosis has always stuck with me as an area of immense interest from a scientific level, and one that is underserved. And it's a women's health condition. It's a longevity consideration, because bone health is something that most women don't think about before it's after menopause, and in many situations late in the game that it becomes aware of this specific part of the body. So I am also an entrepreneur, and my entrepreneurial endeavors are related to bone health and also to brain health, another area where women are more hit for Alzheimer's and dementia than men. So again, another disease that is disproportionately affecting women. And along those two areas of interest, I have, together with my wife and other good workers, created a couple of entrepreneurial companies focusing on technologies and driving these technologies through clinical trials to offer alternatives also to pharmacotherapy as standalone.
And thank you for that. I think I want to start out by, my own background is in advertising as an entrepreneur. I've been working 24/7 and was generally quite disconnected from my body. And I think when I founded 130 Labs, which is a longevity studio and business, that was 5 years ago, my entry point into actually starting understanding how our body and mind works, how connected it is, but also how the female cycle works. I've honestly just, I took conception pills and, I was like not really bothered to to really spend time and energy on that. And I think I think a lot of us, we have grown up in a society where it's not something that has been put focus on. It's not something we've been taught very much about. And when you then dive into understanding, first of all, the risk and like what happens, but just basically understanding the phases of the female cycle, not just our period, but really through life. I didn't know about perimenopause until a few years back. There was so much I've learned through these past years, and I think it's such an important knowledge to share, because what I see with the people, the clients we work with, but in generally with friends, my network, is there's a lot of misinformation, taboo, lack of knowledge, lack of places to go and where you actually can find just advice, just ask questions. And these are fortunately some of the amazing people that helps making that easier. But I think it could be nice to dive a little bit into like, how do we define female longevity? Because for me, it's much more than just menopause. It's also the years after, but it's also the years leading up to menopause, the perimenopause. But maybe I'll hand it over to you to say a few words on that journey. Yeah, now it's like, who goes first?
Okay, I'm from outside, so I go first. And yeah, longevity, female longevity is, generally longevity, I think, is a longer, healthy life. It's not only about curing and treating. It's about having a longer life quality, and in women, it's the life, the longer life, or we are talking about in a quality of life in longevity, is actually beginning in the pre-menopause, not only perimenopause, but pre-menopause, perimenopause, and postmenopause. This can be the premenopause period, can be between around 5 years. Then you have the perimenopause, that can be another 5 years. But then you have the postmenopause, that can be 10, 20, 30 years. However long you will live with longevity. And so our aim, or the future, will be, and this is exactly because I like this setting, because longevity, including cryotherapies, vitamins, nucleotides, whatever you have, is one part, but hormones, and especially counseling on hormones, is another very important part. And what many longevity centers are missing is, yes, they do all good things for your body, but they don't really counsel on areas where medicine or medical knowledge, or also your knowledge, is needed. And I think this is the future of female longevity, is to combine all the other methods, but combine it with what we know, especially about hormones. The same is true for men. Men are very neglected about the hormone levels. The good thing in men, the hormones are decreasing not so drastically, they're decreasing slowly, but they're decreasing. But in women, and I don't want to talk too long, but in women the drastic difference is that in menopause the hormones they fall drastically, all of a sudden from hero to zero, with all the consequences, and there are so many consequences. So I just think what is nice, and we will talk about it, is that we are getting to the combination of longevity methods, 130 labs, others, but we are also getting into the field of hormones and other problems, iron deficiency, thyroid, and so on. And yeah, we will talk about it.
Thank you. Dorte,
Yeah,
you want to elaborate?
I totally agree. We live 40% of our lives post-menopausal, and that has a huge effect on our lives. And in my clinic, I see a lot of women coming on antidepressive medication because they can't recognize themselves. So it has a huge impact, and I think we need to see it in a newer perspective, because in the healthcare professional life, there's been a lot of fear for hormones, and there's the old Women's Health Initiative was a big study, very old now, but they concluded the hormones have a high risk of breast cancer and blood clots. And now when we look into data and redefine it, we figure out, or we see now, that we shouldn't be so scared of hormones as we used to be. So this is important, and I think women needs to be heard, and we need to talk more about it. That's why I really enjoy that we have this talk. And in Denmark in particular, I found that there's a huge interest now in menopause and peri-menopause, because it's so old-fashioned to say, oh, you still have your period, then you cannot be perimenopausal, and you cannot be. So this is an understanding how the fluctuation of the hormone will affect us, and we have a fluctuation every month, but once we reach this perimenopausal stage, the amplitude just is a lot higher and lower, and this can be very, very hard to fulfill your goals in terms of how to be a mother, how to on your workplace, and how to see yourself. But also an important thing to say, that if you are starting, as I do, women on hormone therapy, that it's a pushback to them also. So I'm looking into their BMI, their cholesterol, their blood pressure, and because the estrogen are affecting almost all tissue in our body, and we see that giving just a more personalized version of hormones has the correct effect. So to the correct women who has some symptoms and feel that it's affecting their life quality, in the right dose and in the right way. I mean, we want the estrogen to be transdermal. And then I think we lift them in a period of life where it can be a struggle. And this is important for us doctors, both specialists but also the general practitioners, to understand and help the woman. If they don't feel confident, give them a referral so they can go to a gynecologist and hopefully have a more deeper understanding of what's going on.
Yeah, and I think you touch about something very important, because we talk about pre-menopause, perimenopause, these changes start coming. And I think as women, we are really good at hitting ourselves harder. Why don't I feel as powerful? Or why do I feel more moody? Or why is my body changing? But we blame it on ourselves. And I think a lot of women in this phase, they don't know that it's actually hormones. There is a reason, there's a root cause. And if you don't know the root cause, you don't know how to treat it. Yes, you can treat your symptoms, but it won't really have that significant impact that you're looking for. So I think it's so important to shed light and understand that this is totally normal, and we are going through it. All of us, as women. And some are, have, you know, some feel it more, some feel it less, some feel it early, some feel it later in life, but we are going through it in one way or another. So how can we transition into this phase more smoothly? And honestly, I also think there's also a narrative we need to change. This should be a phase of empowerment, not like the end of life. And I think still many women feel like, okay, now I'm not sexy anymore. I can have, you know, I think there's a lot of mental aspects of it that follows along this transition. So I think it's so important to kind of like, how can we tap into and make that transition smoother, joyful? I mean, I'm not saying the symptoms are joyful, but at least then let's try and make it better and more empowering. Understanding also what's positive with this transition. But maybe you wanna.
Yes, thank you. It's really, really interesting, and I'm really thankful that we're having this conversation. We're starting this conversation about peri-menopause and the phases of the female life. I think one of the most misunderstood things about hormones is that it only has to do with reproduction, and it's all about menstruation and periods. But our hormones affect all tissues. Like you said, estradiol affects almost all tissue in the body. And all of our hormones are actually biochemical communication in the body. And that communication is just a language that we've never really learned, and we haven't been taught to listen to our bodies. We've just been taught to numb our bodies with painkillers when we have period pain, and antidepressants when we don't feel well mentally. And I think it's really, really important to have that conversation about how much our sex hormones also affect our brain, our hair, our vision, everything, our skin texture. Everything is affected by our hormones, but also how much inside of us our hormones affect each other. So, like stress hormones, perimenopause happens at the time of a woman's life where we're also under the most pressure. We have children. I'm a single mom of 3, so I know. and at the same time, we have most demand from our career and from our work. And we go through this hormonal change, and we try to go at the same pace as we've always done. But the body is not intended to go at the same pace all through life. You cannot work like you did when you were 20 years, when you're 50. And that's totally natural. I also think in this longevity talk, we need to address that this is also a transition. It's a transformation to a different kind of life, and hopefully actually a better kind of life.
Yeah, and I think that's such an important point. I think there, in that transition also comes possibilities. Kids are getting older, you feel more secure in your career perhaps, or wherever you are in life, but finding that positive narrative is so important for me. But I think also it could be interesting to tap a little bit more into the symptoms and what happens through this phase. And I think also a topic that is equally important in all of this, especially also with what's happening with medicinal weight loss these years. Like, what about our bones? What about our muscles? Like, there's so many changes, not just mentally, but also physically. Like, what can we do as women to really take good care and again build the strong foundation to go through this transition? And Rasmus,
let me jump in.
Yeah,
yeah, because it never stops to amazes me that we are dealing with one of the most predictable events, and still for many it comes as a surprise, and it's not also from a societal perspective handled in the way that you would expect in a developed infrastructure like ours. So we've seen numerous women in our clinic that is surprised that bone health is part of the consideration when your hormones start to change. So, and the obvious question is, why have nobody told me that I'm to look to my bone density, and that's influenced by a drop of estrogen. So there are some logics there that I'm hoping putting menopause and perimenopause back on the stage can offer us as a society and as individuals to be ahead of the curve. And I think that will benefit a lot when we talk about longevity for individuals. It will also benefit a lot in a societal context. If you look at our health budget in Denmark as an example, we spend 5% of our health budget on fractures that to a large degree can be prevented. It doesn't make sense in any way.
Not
it
at
doesn't
all.
make sense on a life quality perspective for the individual, because there is a very strong correlation between reduction in life quality and having, for example, a fracture and reducing your mobility, and you get anxiety for moving around, getting multiple fractures, etc. So, but as a biologist, there are some constants around the period of menopause that we can know of and that we can study and apply methods and technologies to prevent. One of them is osteopenia. Another is sarcopenia. It's a well-known fact that we lose around 2 to 4% of our bone density after menopause, and a little bit later also our muscle mass, or in particular not only our muscle mass but our force production, so our strength, so to say. So strength, I think, is easier for most people to understand because you can still do some cardiovascular and traditional strengthening exercise, but most of these things are not super efficacious in terms of maintaining your bone density. So it's kind of like a hidden organ system that should have and can be disproportionately influential on your quality of life later, in particular if you intend to live long, that you actually are aware of in the period where the dramatic drop that Christian talked about happens, because that's where you also start to see the dramatic drop in your bone density. So all of these things, instead of just being reactive, switching the entire narrative to empowering women to be more proactive, I think is such a great debate, and hopefully one that will resonate across the board.
I hope so, and I think that's also an important point, because I see a lot of, just in my personal network, a lot of women that, because we don't have this, we are not educated about it. We don't have the knowledge about the phases leading up to menopause. So I see a lot of women, they don't react until, I'm not saying it's too late, it's never too late, but they react when levels have fully dropped, when the shit hits the fan, so to speak. And from my understanding, and this is so important knowledge that I wish everybody knew, is like, when is it you should start? Because again, back to your point on being more preventive, and when is it actually you should start considering, when should I measure my hormones? When should I might consider having hormone therapy, or look into other deficiencies? Because I think the challenge again with our medical system is, I tried to have my blood test done, hormone test. It took me 6 months and 5 emails and calls to convince my doctor. We said, but you have your period. Yes, but I feel something is changing. I just want to test it to figure out where I am in this phase. But yeah.
Yes, and I have that a lot from the patients in my clinic. So one thing in menopause, in terms of measuring it, it's the fluctuation that makes it difficult, because the hormones go up and down. So there is a study where you had the blood sample at the same woman every day, and the amplitude for that I mentioned earlier is really high and low. So that's why it can be so difficult to interpret these blood samples. And also, we don't really know what your normal value should be. So that's another thing in terms of the research that we still need to figure out. If I were to adjust you with your hormones, what am I aiming for? So it's both a measurement, but it's mostly still in terms of how your well-being is. And just to add on the osteoporosis, I also think that we need to mention the cardiovascular, what we gain, because when women reach menopause, there's a lot of estrogen receptors in the vessels. So when we lose the estrogen, the vessels go to be more stiff. So the elastic thing we gain that protects us from cardiovascular disease, we lose that, and then we reach the same statistics as men. So, and cardiac palpitations, or when the heart jumping around, it's so different the symptoms women experience than the men, and all the research has been done on men. So that's why it makes it even more important to ask a woman these questions. And as you say, we talk about this window of opportunity where you should start the hormones not too late, because if you start them too late, then you're actually making the vessels more elastic at a later point, and you have a higher risk of if you have cholesterol or things that are already a problem in your vessel, when they become more elastic, there's a higher risk of blood clots, because it loosens whatever is in the intima of the vessel. So it is important to understand that menopause is not a disease. It doesn't have a diagnosis because it's a natural thing, and it shouldn't be a surprise. And if we do something about it earlier on, we can prevent a lot of those things. And done correctly, I think that in terms of blood clots and breast cancer, it is so low. So there was a big Lancet study talking about this breast cancer risk, and unfortunately here in Denmark we all have a 10% risk of having breast cancer. If we take hormone therapy, it's maybe 0.5 to 1% we add to that, so it's like maybe 11. And I have to tell the patient that, yeah, I cannot say there's not a higher risk, but it's relatively low compared to if you do exercise maybe 30 minutes per day, you lower your breast cancer risk by maybe 50%. So everything is relatively, and in the bigger picture, if they understand that and you take them on that journey, it's a lot of communication for my part, because I think we need to make the woman understand, and for her to choose together with the doctor what is the right thing to do for her.
Exactly. I'd like to add to that increased risk equals having 1 glass of wine per day, and the risk and cigarettes, yeah, and the risk is actually higher if you have your children later in life opposed to earlier in life. So that's a pretty small risk.
Yeah,
and BMI.
And I think, yeah, Christian, if you would add to it, we had many of these discussions because it's other risk follows.
Yeah, it's we don't have the time to discuss all these breast cancer risk, and just for example, if you take estrogen alone, which you can only do if the uterus is if you don't have a uterus anymore. If the woman has estrogen alone without uterus, for example, breast cancer risk is even lower compared to it. But it's too long. But I just want to come back to what I want to bring it a bit on the political or social discussion, because the question is, and this is regarding longevity, is a lot of preventive. Longevity is a preventive medicine or preventive living. I want to get rid of this medicine. Longevity means preventive thinking and acting, and it means self-consciousness and awareness and self-responsibility, and it means also to have the partners to talk about it. And for example, we started a small pilot thing in her studio where women come. They can talk to me for an hour about their issues, their problems, peri-menopause, hormones, iron, whatever. So, and I think they are happy just to talk and somebody listens. Of course, in a clinical setting, you don't have the time to talk 1 hour. We don't have, but you can take it outside of the clinic and try to set up settings where you can talk about your problems. And if you don't have anybody to talk about your problems, yeah, that's bad. But then at least you look inside yourself, and you look for yourself, for your problems. It's the same. I mean, you're mentioning bone health. I mean, it's so easy to look for the drop in. You know, in the moment the estrogen goes to 0, you are starting with all the problems, 50 symptoms plus bone demineralization. It's easy. The same is true for iron deficiency. I mean, 30% of women are iron deficient worldwide, around 30%. Every third of you probably has iron deficiency. It's, first of all, nobody's really interested, and second, nobody's treating. It's treating with iron tablets, but not with infusion. This is another dimension, but it's another example, okay? And if you add thyroid or vitamin D, just 4 factors, that can dramatically change your life. If you normalize these four, just these four, we don't talk about all the rest, you can dramatically improve your health. Estrogen, thyroid, iron, vitamin D, for example, okay? That's not magic, that's easy, but nobody's really interested in it. And this is, in Switzerland, it's the same. That's why women come, because give me my iron, give me my hormone. It's the same, you know. So we have to create the awareness, which we do on the women's side, but also, of course, on the other side, whoever it is, you know. And if the doctors don't do it, then longevity panels will do it, and then they lose their job. Yeah, that's a fact.
And you're absolutely spot on. And as an example, now you've seen the discussions in the Danish political scene around the chronic diseases and the new and osteoporosis is an example of that. The Union for Osteoporosis Patients is fighting to get it in there because it's 700,000 people in Denmark that have the diagnosis or that have the disease, but most of them actually don't know it, so the numbers look smaller. But you know it's only a third that is diagnosed. So, and again, it's an 80% women's disease. So I don't know the reason for it having been neglected, but it just strikes me so much that the level of predictedness that 50% of women will face this challenge at one point in time after menopause, and still you have nothing in terms of from a health system that systematically addresses it, informs about it, and offers preventive thinking.
Same for dementia and the things you can really help, right?
Yeah. So it needs to start somewhere else, and that's often how it is. You know, then it builds momentum, and dementia is a good example. Also, how many here knows that that dementia and Alzheimer's is around 70% of the diagnosis is in women? You don't know that, but it means that women need not exclusively, but to be extraordinarily aware of the symptoms. If you start losing track of names or things that you normally have after menopause, of memory, start losing track of words you normally use, you should be aware that this is an area that you should focus on and not just neglect, as you said, Tine, until shit hits the fan. Because you have, similar to the skeletal system for the brain, you have many years of plasticity that can accommodate cognitive function loss. But at one point in time, you're beyond your capacity, and then it drops really quickly.
And that's exactly what's so important. Like, how do you find out when is the right time? And that's really shifting back to be curious, to investigate, to seek advice earlier on, because then you can actually do something before it kind of tips over and becomes really hard to make that change. But I think also what, from my understanding, is if you start hormone therapy too late, for example, risk of these diseases, these chronic conditions, will increase rather than if you kind of smooth that transition out with hormone therapy.
But also with lifestyle interventions.
Yes.
That's actually something we don't have clinical studies on that much. But what happens during perimenopause is that it's actually an inflammatory state. And after menopause, it's just even worse. And if you all just heard Jesper's talk about inflammation and his suPAR testing, that's really something to look into when you're going through perimenopause and also menopause. That's facilitating like most of the downsides that you're talking about, like the neurodegenerative symptoms and bone density. Everything is connected to this inflammatory state that menopause is, because when your FSH levels goes up and your estradiol's drop, it affects your whole metabolism and your immune system, and you just become more inflamed. Yeah, and that you can do with lifestyle as well. It's not just all estradiol therapy or progesterone therapy. It's also taking more care of yourself. It's just it's a point in life where you need to nurture the body a lot more than you're used to. So you cannot go on in the same pace. Even though if you take hormone therapy, you still have to think more about the body and listen more to the body. And yes, listen to the body. That's the most important thing, I think.
Yeah, I mean, that's right up my alley, and obviously what we work a lot with in 130 Labs. But and I think we have so many women coming in and they have forgotten, as you say, to actually just be gentle, be caring for themselves. And what I also see when we look at perimenopause, menopausal symptoms is obviously if your foundation is not good, if your general health is not good, your symptoms will most likely be much stronger. And this is also tapping back to longevity. To me is really how do we become the best version of ourselves today, because if we do that, we will also be the best versions of ourselves in the future. That then you will have not just lifespan but really true health span. But it starts today, and it starts really by not accepting poor health as a norm, not accepting that it's normal to feel bad, feel depressed, have pain, have headaches, have whatever symptoms you have, bad sleep. This is not the norm. We can do a lot with lifestyle, and knowing then what deficiencies we have, we can actually then build a completely different health and well-being for ourselves. We are kind of closing in on time. There's so much to discuss, but I want to give all of you a chance to kind of give a final remark. What is the key takeaway advice? Dorte, you wanted to say something?
Yeah, I mean, it's the sustainable way that's mentioned before with the pushback. I can do something for the right kind of patient with a prescription, but it doesn't stand alone. So it again, with the lifestyle and also how long you can take hormones, so that it will be a very important talk that if we do something, that they also carry themselves in a wise way. And then in Denmark, we're looking more into, I mean, how maybe we can prolong. It used to be 5 years that you can take hormones. It can be 10 if you don't have any other risk factors. And those risk factors, you need to look into yourself and make sure that you carry yourself wisely. And so this is actually my take-home message would be, do you have the symptoms? Don't just settle for less. Keep on asking your doctor, and if they don't feel confident, push forward to have a referral for someone who can understand your problem and maybe see if you are in the category that needs a prescription or not. So don't stop and aim for more.
Yeah, thank you.
Admittedly, I'm a bone nerd, and I can talk for hours about the details. If you have any questions relating to it, or are curious for something specifically relating to what we talked about, come see my wonderful wife, Kirsten, in the OsteoStrong booth. I'll be there for the next hour, and then we can go into the nerdy field of bones, if anybody's interested. Other than that, I'll just say thank you very much for a wonderful conversation.
Christian?
Oh, thank you, and I agree with most what you said. Don't suffer unnecessarily, and don't suffer too long. Look inside yourself. Look into your deficiencies or your body. Look who can take care with you or for you. And if you don't find that person, or if you don't find that person in your doctor, change the doctor.
Yes. Caroline?
Yeah, and my take-home message would be that show up prepared for perimenopause and menopause. Don't show up all exhausted and drained. Show up with vitality and a strong body, high muscle mass, and a lot of nurturing. Make this a transition into a different part of your life where this is all about nurturing yourself instead of the fertile phase where you nurture your children.
Thank you so much, everyone, and thank you for sharing your knowledge and insights. Thank you for listening. And I think from my perspective, the same. Don't accept not feeling well. There's so much to be done, both naturally and also if the time is right, and if your individual footprint matches, there can be help done also from the medical part. But seek advice, be curious, come and talk to us. I really try with 130 Labs and the podcast and this event to create a platform where we bring a lot of experts and make it easier for some of you maybe to figure out who can I go to, who can I speak to. So don't sit at home and feel like shit. Sorry, my language. Yes, we should all feel great. Yeah, thank you so much.
Thank you so much to the panel, and I mean, what insightful conversations, and also really highlighting the fact of the importance of female health, and also, like you say, so many different aspects to how we can approach these kind of, let's not say problems, but these kind of challenges. So thank you so much for everything that you do.